Hello, hi guys, welcome to Two Dogs Podcast. I'm Dr. Ellie here.
And I'm Dr. Ingky, and welcome to the Two Dogs Podcast. Most of the time, it's two doctors speaking about non-medical stuff, but this month is different, right?
This month we're on a roll.
Yeah, this month is International
Mental Health Month.
Right? So, in the previous episodes,
Yes.
right, it's both of us talking.
Correct.
Right, but today
We
itself,
promised something special.
Yes.
We promised something
we have
different.
an expert.
Correct. We need a proper expert.
Yes, we need a proper expert. So who we have here is Dr. Kohini, who
Yeah.
is a certified psychiatrist.
Psychiatrist.
But this is not her first time on the podcast.
No. If you guys rewind back, I think episode 5 or 6.
Yeah, 5 or 6.
Way in the
Long
beginning.
time ago.
She was with us right from the beginning,
Yes,
right from the
correct.
birth of the Two Dogs.
Yes, correct.
And now we're at episode 122. If you're
Yes.
Wow.
Really?
Congratulations, guys.
No problem. Right, so let's jump straight to it.
Yes.
Right? Let's talk about depression in general.
Depression,
Right.
especially in the workplace.
In the workplace.
And because we also want to shout out to Docquity app because this episode is going to be
will
broadcasted.
be on the Doctor app, which is a social platform for doctors.
Yes,
All right.
like a Facebook for doctors.
It's like a Facebook for doctors. This is like a LinkedIn for doctors, right? So because this one is going to be primarily featured on Docquity, we'll be talking about workplace depression, especially in the healthcare
healthcare
industry.
Yeah, but it's still applicable for any
Other workplace.
But we would just sort of like ask more questions about doctors and nurses.
Yeah. So the first question would be,
I think get her to introduce
yes,
first.
okay, you introduce yourself.
Yeah, sell her a bit lah.
Yeah, okay. Yeah, psychiatrist.
All right, so we have Dr. Kohini with us here. Please introduce yourself a little bit for us because obviously Ingky didn't do a good
No,
job
I'm
introducing you.
horrible, yeah.
All right. So, hello, everyone. And thank you to the two doctors for having me back here after about 2 years, I think. Yeah.
2 years.
All right.
It's been 2
So, it's good to be here and to be talking about something which is certainly very important to all healthcare workers out there. So, I think it's good that the two docs are highlighting this important issue.
Right. So come.
Okay.
Question.
So first question,
Yeah.
it's how does one identify whether their co-worker has depression or not? Because I've actually heard stories even back in my time, right? I've heard stories of co-workers or my colleagues quitting because they're depressed. Some actually attempting suicide, right? Because they are actually depressed.
In fact, this was quite an issue a couple of months back.
Oh yeah,
A couple of months back, I
there
think-
is a
I
couple
think,
of housemans.
That's
yeah,
right.
I've got interns that
houseman who or new MOs who one of them actually committed suicide.
correct.
And they cited workplace depression.
Yes. What are the telltale signs
All right.
of depression?
When we're talking about looking out for depression in a coworker, so I think we have to admit that it's certainly not as apparent or easy to pick up on as a physical disability, right? But some of the telltale signs would be things like, does your colleague suddenly seem very withdrawn, right? So keeping to themselves more. They don't seem to want to interact much anymore. There's a lot of poor communication going on. Other things would be, do they look tired all the time, right? Do they appear that they are lacking sleep? Or have they actually mentioned, on the other hand, that they just lack a lot of motivation and all they want to do all day is just sleep, all right? Other things you can look out for, do you notice any changes in their appetite perhaps? Maybe it was a colleague of yours who used to enjoy some after work dinner and drinks together, or you would enjoy going for lunch together, but nowadays this colleague is just not interested. All right? Or do you see the opposite? Perhaps your colleague now is snacking a lot on a lot of unhealthy food, something which they didn't do in the past, right? These are some of the things, along with some other things such as, do you notice that your colleague has difficulty concentrating and focusing, right? Maybe things need to be repeated to them many times. They are now taking a lot of time to complete their tasks, which previously they could do very well. And they just don't seem to have the drive anymore to do their work, to complete their work. And do you maybe notice that They're even coming late for work sometimes, or a lot of the time on MC or absent from work, right? Do you notice them to be sad, right? Sometimes you may see them sneak off, tearful, right? Crying in a corner somewhere or in the toilet. Yeah, things like that would be some signs as well. Basically, what we want to look for is anything in them that departs from what is their norm. All right. So, workplace is somewhere where we spend most of our time,
Yes,
right?
yes.
So, to be honest, colleagues, co-workers are sometimes the first people who notice changes in us. Have they gone beyond that and actually mentioned that they feel that their life is worthless, hopeless, not worth living? Right? Do they actually express that I feel like I don't want to live anymore? Those are some of the things that are going to be red flags for you, and anything that would be different from what they usually are like.
Okay. I'm just going to jump into the deep end and ask you some question regarding that. So this would actually work better when you know someone for quite some time, right? But let's say in a workplace whereby someone is new, and you know, even when they come into a new workplace, there is adjustment disorder, or
That's
there's inability to adapt as quickly as they should. How are we going to identify or differentiate someone who, let's say, is withdrawn versus someone who's actually totally lazy?
All right. So,
Happened, right? Hospital?
Yeah, it is.
so the key thing here is the human interaction, right? You have to engage with people to really get to know them. So the easiest thing would be to talk, right? Start a conversation with them. Try and get to know them. Once you get to know them, and then I'm sure there's a group of you working together perhaps, then you can see, all right, do I find anything unusual about this person? Do I think that he might need help with something? And then you have to go from there, right? So the first rule I would say is actually to engage first, right?
Okay. Okay. I like her answer. She's so calm now.
Yeah. She's so calm. I think it's from speaking to
To the two dogs, I think.
yeah.
2 years ago we grilled her quite well.
Exactly.
Yeah.
Exactly.
Now
So
we're
generally, who is most at risk?
All right. If we want to talk about occupations in general that are at risk, right? So, interestingly, there was a labor force survey that was done in Britain. All right. I think it is something that they do periodically over the years. And they found that there was a rise in self-reported depression, stress, and anxiety at the workplace in general over the years.
Self-reported.
Yes, so this is even before the pandemic, right?
Okay.
Even before the COVID-19 pandemic. And recently there have been studies that have shown that there is a loss of 12 billion days in a year to depression and anxiety, which is amounting to like $1 trillion in loss of productivity in a year, right? So that is the impact, yeah. And this same labor force survey looked into which occupations were most at risk, right? And they did come up with 2 industries that had the highest risk, and one of them was healthcare workers and social workers. The other one was the education industry.
Okay.
Right? And recently, very fresh off the press, WHO has come up with the guidelines on mental health at work. And one of the special populations there are actually emergency responders, healthcare workers, and humanitarian workers. So we can see that healthcare workers are certainly at an increased risk for depression, stress, and anxiety at the workplace.
Is that COVID related because of the recent pandemic and work stress, or it's more of that's the current trend that's already going into it?
So this has been in existence, like I mentioned earlier, the rise that we've been seeing was there even before. So the projections was that it was going to rise. This was even before we knew about the pandemic. Right?
Okay.
And even in the last decade, there was a survey in the US that found that physicians had higher levels of burnout compared to other occupations. So we can see that it has healthcare workers have always been at risk. And I would say that it is also because of the inherent nature of the healthcare worker. The job itself poses a lot of risks in terms of stress, depression, anxiety.
Yes, that's right.
And I think also, correct me if I'm wrong, but the personality of healthcare workers itself, because we are a bit more stringent, we are a bit more, how you say, we need to meet a certain standard.
That's right.
Plus, you might impose a lot of self-regulation or self-standards that you want to achieve, apart from trying to be a lot of times perfectionist in the profession, because you're dealing with human life.
Certainly.
You're not dealing with just something that you can change tomorrow. A wrong decision, someone's life is endangered.
Correct. And because at a healthcare professional or a social worker or a humanitarian worker's workplace, people come to them with issues.
Yes.
Right. People don't come to them happy. People come to them with issues. So if every day and every person you deal with has very bad issues, eventually it takes a toll on your emotions.
That's right.
Eventually you will tend to bring them home after work, right? It doesn't just clock out after you punch out, right? So it's not like some professions whereby it's more technical.
Yep.
You deal with numbers, you deal with facts.
Yep.
So you can leave the facts at work, you can leave the numbers at work, and then you can go home. These are people that suffer. These are people that tear in front of you. These are people who have lost something very personal to them.
Yeah, they need you. They need you on the dot stat.
Yeah, they
right
need you
now.
on the dot stat. And I think one of the main issue is we are not trained to handle the emotional part. Now, we are trained to diagnose,
Yes.
and
Right.
to prescribe.
Yes.
We are not trained to handle the emotional
The
part.
emotion part, and especially when it's the illogical part. Someone who comes in and they lost someone, it's supposed to be sad, but they're angry at you.
Yeah,
They're
they can be angry
resentful
at
at
you. They can be
They're
resentful.
impatient with
Yes.
you. So many other emotions come in. They're not here to be thankful of you for helping, let's say, a family member, but they're here to show a lot of negative emotions. Yet they still need you to help. They still need you to perform at your 110%.
Yeah.
That's right. These are some of the, certainly some of the factors of why healthcare workers are definitely an increased risk. They are repeatedly exposed to situations where they are confronted with disability, sickness, death, right? And the whole ecosystem of healthcare workers is that you're not only dealing with the patient,
Yep.
like you said, you're dealing with their families. You're dealing with your co-workers, you are dealing with supervisors, all which have piled on stress, right? And not only that, we have to remember that for healthcare workers, work is one part of it, like you mentioned. We forget that they have other aspects to cause them a lot of stress. Relationship issues, family,
Finance.
right, exactly. So they've all got that going for them as well. And the fundamentals of being a doctor, that you always tend to put others before yourself, right? Or not only doctors, healthcare workers in
Yep.
general.
Yep.
It's always about putting others first,
yes.
which is why this group of people ends up always forgetting to take care of themselves, physically, emotionally, psychologically.
Coming to the word psychological, Dr. Kohini, what's the difference? A lot of people would like to know what's the difference between a psychologist and a psychiatrist.
This is the common question that
Yeah.
comes up. But we must remember that most of the time, or almost all of the time, psychologists and psychiatrists work together because they are both mental health practitioners, right? If we're talking about healthcare workers who want to seek help, since they might have a bit more awareness about what a psychologist might do and what a psychiatrist might do. Psychiatrists, if you find yourself in a position where you find that you just cannot function anymore, you feel very disabled, right? You can't even bring yourself to the next day, you might need some medication. So psychiatrists are able to prescribe the medication, right? So you might want to see a psychiatrist, right? Or if you have the awareness that my condition is something that most likely needs something more than therapy, it needs medication as well. So yes, perhaps you would go towards seeing a psychiatrist. If, on the other hand, you have maybe interpersonal relationship issues or certain issues which you feel you need a little bit of help by talking to someone, talking things through, perhaps you want to visit a psychologist, or you feel that you need a little bit of help with coping with certain situations, right? And you feel that there's no role of medication at this point first, or you want to try not being on medication first, but you want to try some therapy first, then perhaps you visit a psychologist.
Okay.
But whatever it is, at the end, there is really no hard and fast rule whether you should see a psychiatrist or a psychologist.
Seeking a bit of help is better than no help.
Yes, because whomever you go and see, either of them will know where to direct you to next,
Okay,
right?
okay.
Because referring between psychiatrists and psychologists are very common, especially because they work together. It's complementary, right? They complement each other. So it's never going to be wrong, should I see a psychiatrist or a psychologist? There's no wrong answer for that. You can see either one and you will get the help that you need.
Okay.
All right. So last question before we end everything. So since we're talking about workplace depression, what can companies or corporations do to help identify or to help their employees get over this particular difficult time?
Right. So the first would be actually at the top level, at the leadership level, right? So you have to have leaders who are able to accept and want to be mental health advocates. That's the first thing, right? So once you have that awareness that mental health is important and I want to implement something in my department, in my company to help my employees, then you go on to the next step. The investments that you need for it, right? You will need funding, you will need resources to help you come up with the policies, come up with the guidelines. So what is important here is coming up with certain guidelines for your company or for your department, your employees, which is going to help them get the mental health help or psychological help that they need. And then it's about engaging the correct people or organizations who can help you come up with those guidelines. So that would be things like occupational safety and health, right? Or even psychologists, psychiatrists, those in the mental health framework, right? So you would need to engage with them to find out how you can go about and what are the important aspects to come up with your guidelines and policies. Once you have that, it's also about training, right? So you will need to train certain people in your company to be able to identify, or you can do training or surveillance periodically for all your staff, right? And it's good to include those with lived experience, right? Because they are the ones who are going to be able to tell you what they went through, what worked for them, what didn't work for them. So that's going to be very helpful. And finally, whenever we want to implement something, we also have to always make sure that we evaluate and see whether our interventions were effective.
See, told you she's so structured now.
Yeah, that's why. That's why, it's not like both of us, we jump all over the place.
Yeah, it's like as though she had all scripted out for us.
Yeah, there's no script. There's no script in front of her.
Anyway, guys, this is Dr. Kohini with us on the Two Dogs, and she's a practicing psychiatrist in a hospital.
Yes, correct.
So if you want to talk to someone lovely who actually knows what she's talking about in a very structured manner also, apart from being very caring, you know where to go.
Yeah.
You know where to go. Yeah.
Thank you.
When you talk about employers who are committed to mental health, and you're saying they must have a certain awareness, I think what would be the fundamentals? What should they keep in place, or how would you advise an employer to take the first step? I think this will be the last question from me.
All right. I think with the evidence and the data you have that so much productivity is lost. Yeah. to psychological distress, right? So we cannot deny the facts that are there, right? How are you going to then deal with that, right? And with the pandemic especially, we have seen, right, levels of emotions, depression, anxiety all go up a lot, right? And people are starting to rethink their lives. What do they want? What's important for them? So if they're going to strike a good work-life balance, right, having this kind of psychological backup at your workplace is certainly very important, right? Because people are very aware now about things like burnout, stress at the workplace, right? So certainly they would want to be at a place where they are supported, where they feel supported, and where they feel there are supports to help them. So I think that's the first thing that employers should understand. And from there, understand the employers that you have, and understand that it's important to take into account their psychological and social backgrounds and their welfare. Make it as important as how you would consider a physical ailment, right? Because a lot of the time, there are a lot of provisions in company guidelines for physical disabilities,
Yep.
right?
Yes, correct.
But
Because that's very obvious.
yeah. So, so what we should try to do is bring up psychological awareness to be on par with a physical disability, for example.
I like how you mentioned in the beginning when you talk about some of the signs of co-workers having telltale signs, and one of it was actually taking MC.
Yeah.
So I think most companies, the HR should also take a lead. If you see frequent MCs,
That's right.
That's also one of the telltale signs.
Yeah, that's one
right.
telltale sign that something's wrong.
Correct.
That's right.
Once upon a time when I was doing GP, and I think Dr. Ingky will agree with me, is that we always feared this serial MC takers.
Yes, correct.
People who come in with frequent MCs.
Yes.
Right? But the doctor always think that they're lazy.
The doctor will always think that
The first impression is
the first impression
lazy
is
fella.
that,
On a
that
Monday,
they do not want to go to work.
Monday
Yes,
don't want to go to work. Friday don't want to go to work. But they don't realize is that Monday could be Monday blues. You're so
Yes.
depressed that you can't go to work.
Yes, that's
Alright?
right.
And
Absolutely.
Friday, because it's not because you want a long weekend, but you are burnt out.
Yes, correct.
You're
That's right.
so burnt out that that's the only last day you want to take and have a nice long weekend. So I think as doctors, and I think doctors who are listening out there, if you see someone who is so-called in inverted commas frequent MC seekers, ask them,
Yes.
how are you? What's going on?
Absolutely.
Correct.
What's going on? You know, I notice you're having a pattern of MC. What's going on? You know, and just let them open up to you. If
That's
they
right.
don't give you a good answer,
Yeah, that's
then
fine.
you can go
Yeah.
back to your pre-conclusion. But if they do, a lot of times I think you might be able to catch someone who is in the initial phase rather than they spiral out a bit later.
That's right.
Correct me if I'm
That's
wrong.
right.
So that's why always engage.
Engagement. There you go. Engagement. All right, guys. So thanks for tuning in. We are especially thankful to have Dr. Kohini here. We will be back with her next week on another session on mental health. Because again, commemorating International Mental Health Month,
Mental Health Month.
we have committed to make the whole month long
The
episode.
entire month, right? All the episodes are dedicated to mental health.
Correct. So
Wonderful.
please drop us a couple of comments, like, share, the
Like, share, and
content,
subscribe.
and subscribe. And we will be back with you next week on the Two Dogs.
Yes.
And this is us signing off. Have a good weekend.
Have a good weekend.